Gage Kumar here, crushbackpain.com. I'm going to do a series on lower back pain, and we are going to cover lower back pain, types of lower back pain, what generally causes lower back pain. We're going to talk about the usual treatments for lower back pain, primarily drugs, injections, surgery, exercise. We're also going to talk about imaging for lower back pain, x-rays, MRIs, and how important imaging is in the treatment of lower back pain. To start out with this first video, we're going to discuss the usual type of lower back pain. So if you take everybody that has lower back pain, only around 2% of the lower back pain that people have is caused by an infection, a tumor, a fracture, or a serious medical issue. So it's very rare for lower back pain to be caused by anything other than a musculoskeletal issue. So right around 2% of lower back pain, again, is caused by a tumor, an infection, a fracture, or an underlying serious medical issue. About 10% of lower back pain is caused by nerve root compression. So that leaves 85 to 90% of lower back pain cases that are musculoskeletal and mechanical in nature. And a lot of times in the medical literature, this is referred to as non-specific lower back pain. It's called non-specific because there's no smoking gun per se. There's nothing that people can point at and say that's 100% the cause of this person's lower back pain. We know that it's not caused by nerve root compression. We know that it's not caused by a tumor, an infection, a fracture, some sort of serious medical issue. It's musculoskeletal and mechanical in nature 85 to 90% of the time. And so that's what most people have that have lower back pain. Now, within that 85 to 90% of people that have musculoskeletal mechanical lower back pain, there's a number of different issues. There's a number of different pain generators that could be causing the pain, but it's all lumped into that 85 to 90% because it's not a life-threatening issue. It's not something that usually needs to be addressed surgically or from a serious medical standpoint. First, let's talk about that 85 to 90% of lower back pain group. So what most people have when they have lower back pain, a big musculoskeletal group. We call it non-specific, but that doesn't mean that there's not a specific pain generator or several pain generators. We just call it non-specific because, as I alluded to, we can't with 100% certainty say that's the cause of that person's lower back pain. We oftentimes have x-rays, we oftentimes have MRIs, we have these pictures of the spine, and we see different changes that we think may be related to this person's back pain, and then we try to correlate the imaging findings with the clinical picture. And sometimes the findings correlate, go together, sometimes they don't. But we put a lot of stock in the imaging findings, and we'll talk more about imaging in a video down the line. But out of that 85 to 90% of people that have the run-of-the-mill musculoskeletal mechanical lower back pain, the majority of the time that lower back pain is going to be caused by a disc, a FACET joint, or the SI joint. Okay? And you can't always tell from an MRI or an x-ray, even though that's the go-to procedure for lower back pain. Everybody wants an MRI or an x-ray because intuitively you say, hey, I get a picture of that structure, I see if something's wrong with it, I know what's causing the pain. But there's a lot of incidental findings, there's a lot of false positives. As we age, there are going to be bulging discs, herniated discs, there's going to be facet joint arthritis, there's going to be a number of different things that happen to spines as we go through life that are oftentimes not painful at all. And so it's very difficult most of the time to blame pain on what you see on an MRI or an x-ray, because the same amount of people will have those findings, those age-related changes, I like to call them, on MRI and x-ray. The same amount of people will have those findings that don't have lower back pain compared to people that do have lower back pain. Now that's not to say that the bulging discs, the herniated discs, the facet joint arthritis, etc. That's not to say that those things don't cause pain. It's just to say that it's difficult to always blame the pain on those findings when just as many people without lower back pain have the findings on MRI and X-ray compared to people with lower back pain. So again, when you look at the three primary structures that usually cause lower back pain for that 85 to 90% of people that do have back pain, we're looking at the disc, that's the red structure here. We're looking at the facet joints, which are these little joints right here. When you move, these joints glide against each other and move. And then we're also looking at the SI joint, which is just simply the joint between your sacrum and your pelvis, your ilium. So SI joint, sacroiliac joint. There's a joint right here. You see it a little better from the front. That's the joint. It's the joint between basically your tailbone and your pelvis. Okay? So, in most people with musculoskeletal lower back pain, one of those three structures, or maybe several of those structures, are going to be the pain generator: the disc, the facet joint, or the SI joint. Okay? Now, it's good to try to determine which of those structures is the primary pain generator. But what's even more important is to figure out what activities people are doing, what positions people are in repeatedly day in and day out, what repetitive movement patterns people have that are irritating those structures, causing inflammation, causing microtrauma, and causing pain. Most of the time, people with lower back pain don't have a specific injury mechanism. They have pain that comes on over time. They have intermittent and recurrent lower back pain. They'll go periods where they don't have back pain, and then they'll have periods where they do have pain, and then it'll go away, it'll come back, it'll go away, it'll come back. Hence the term intermittent and recurrent. So there's usually things that people are doing that are irritating the facet joint, the disc, the SI joint. There could be muscle imbalances that are making it where those structures have too much force through them, causing low-level inflammation, low-level microtrauma that's causing pain over time that reaches a threshold and then manifests as lower back pain. So, believe it or not, and it seems counterintuitive, but it's more important to figure out what you're doing that is contributing to your pain, movement-wise, positioning-wise, and addressing that, instead of focusing on what structure is painful. In the lower back pain world, the entire focus is on diagnosing the painful structure, and that's why we do all these imaging studies, the MRIs, the X-rays, and we look at that, and then we say you have a herniated disc, you have a bulging disc, you have degenerative disc disease, you have degenerative joint disease. There's a bunch of different labels that we give to these findings on imaging. And then people feel like they have a bad back. They feel like they're destined to have a lifetime of lower back pain. And what they're not told is they can have these imaging findings and be completely pain-free. The key is figuring out what you can do to stop stressing the tissues to the point where they become painful. And once you find that out, then you can also load the tissues over time, load with exercise, specific exercise and movement work. You can make those tissues more healthy, more resilient, stronger, so they're able to basically withstand the day-to-day kind of grind, the day-to-day wear and tear without becoming painful. That's the long-term solution to lower back pain, opposed to trying to figure out what tissue is painful and then treating that tissue directly. Even if you get the tissue right and you treat that tissue directly, if you continue to do things that aggravate that tissue, that cause it to become inflamed, that cause it little micro injuries, you're going to have pain again. So the long-term fix for lower back pain is figuring out what you're doing that's making the lower back hurt, correcting it, and then building that tissue up with the correct exercise and movement work so it doesn't become painful. And that's what else this lower back pain series is going to look at. So this first video, we covered the different types of lower back pain, the fact that 85 to 90% of the time lower back pain is mechanical and musculoskeletal in nature, and that in that 85 to 90%, there's a high likelihood that the pain's coming from the disc, the FACET joint, or the SI joint. In the next video, we're going to look more closely at the disc related pain, the FACET joint related pain, and the SI joint related pain. If this video helps you, leave me a thumbs up below, subscribe to the Crush Back Pain YouTube channel, and check back weekly for proven methods to beat back pain.